everybody, it's Hilary Cragg here again. Today I want to talk about how you would know if you might have a dementia, or how a family member would know, and the issues are pretty much the same. So how would the person with a dementia know? In principle, it's because something is different. And something continues to be different. So it's the loss of an ability that you already had that isn't recoverable. Dementia is around damage to the brain that's a permanent damage. So it's not recoverable. And that means that whatever is different is not recoverable. Now, the brain and the body adapts well if there's an illness or an injury. So for anybody who loses, for example, their hearing, it tends to be that their sight gets better. If people lose a limb, then they learn to adapt to living without it and using the other limbs. But people learn to adapt, and the brain in the same way learns to adapt. But over time, there will be a noticeable issue and a noticeable difference that is not recoverable. So it's not something that comes back. Now, first of all, the person themselves with the dementia might notice there's something, but not sure what it is, not sure what's happening, how to deal with it. And the chances are the damage in the brain has been going on for a while, and that the brain's just been adapting, and that nobody knows about it at that point in time, because the damage will be really tiny, and the brain just sorts it out and deals with it. But over time, because the damage is progressive and it keeps getting worse, and it more and more damage keeps happening to the brain, eventually the person themselves will recognise that something is wrong, but not necessarily being able to really say, I'm forgetting, I'm losing language, I don't know what's wrong. And it all depends on where within the brain the damage is, will depend on how that presents. It tends to be remembering and understanding that is affected, but in unusual cases it can be visual spatial awareness, it can be sight, it can be hearing, it can be language skills, so people can understand what is being said to them but not actually be able to reply back, or vice versa. So it can affect all sorts of things, but what that person will notice is that there's a problem that isn't recoverable. And initially, quite often they tend to hide things, and they tend to just think, oh, it's aging. And in truth, we do lose some ability over time through aging, and initially it will seem just like an aging process. But what will happen is it will develop apace, and it will get much worse. So it's beyond that normal aging process, that normal slowing down that happens with age. Age is the biggest risk factor for dementia. And so the older that person is, the more statistically likely that they are to develop a dementia. But just because somebody's old doesn't automatically mean that they will develop a dementia. But age is the biggest risk factor. So how would the family member know? They would really know by noticing that something's changed, that something's different, that their loved one is no longer able to manage in the same way that they were managing before. And how it's tested for is really an elimination process, because the only true way to absolutely be certain that the problems that are happening in the brain is a dementia is usually through an autopsy post-death. And obviously you can't do an autopsy while that person's still alive. So although you can scan the brain and you can see if there's some damage in the brain, it's usually only indicative that there's damage, and it can be quite difficult for medical professionals to piece together what happened as to why that damage came about. And so lots of it are around assumptions that it's not something else. So that's how it's generally diagnosed. It's starting off by eliminating other things, so eliminating the organic problems, such as disease or illness or infection, and making sure that that person doesn't have some kind of underlying infection or depression, because in fact depression can present very much like a dementia in some circumstances. So dementia is generally diagnosed once other things have been eliminated, and then dementia becomes the thing that remains. And if somebody's early years or has an early onset, which is considered anything under 65 from the clinical perspective, dementia tends to be not considered quite early because age is the biggest risk factor. Dementia is one of the later things that people get considered with. So they'll healthcare professionals tend to consider other diseases first, because early onset dementia is relatively unusual. So it's really about just making sure it's not anything else. And then finally, depending on some of the things that have happened with that person, you can then work out what that dementia might be. If they haven't had any strokes or health conditions that might relate to vascular disease, then they would be able to eliminate vascular dementia being this specific form of dementia when the diagnosis happens. And it's usually quite useful to know what kind of dementia is being presented within that person, because it helps to understand what they might be going through, if there are any therapies that are possible, including drug therapies that are possible to help with that condition, and also likely diagnosis and progression of that disease. So that's why they try and diagnose specifically what the form of dementia is, because there are many of them. So I hope that's helpful, and thank you very much for watching, and I look forward to seeing you again soon. Bye for now.